Hopefully we still have time for the last talk, which is Polyzois, who's going to map ECD in Europe. Thank you, Polyzois.
Thank you, Matt. It's a long session, isn't it? So, I'm Polyzois Makras. I'm a endocrinologist from the LCH and ECD Center in Athens, Greece, and I'm gonna present you how we could map Erdheim-Chester disease both in Europe and probably globally through the Core Registry. So these are my disclosures. And I'm gonna give you some small introduction regarding the ERN. ERN are the European reference networks that they were launched back in 2016. And a couple of years later, we had the launch of the European registries for rare endocrine conditions, named as Eureka. And it is 1 year and 2 years later that we had the launch of EREC. EREC is a symbol registry, and then the Core Registry, which I'm going to show you later on. And in 2020, we had another registry, namely the European Registry for Rare Bone Conditions. It was called Eurobone. And after the end of the original funding, both the two projects were merged to one registry, the Europe Registry. It is the registry of the European Registry for Rare Endocrine and Bone Conditions. So, the registries in a nutshell, it's whenever you, any patient with a rare endocrine and bone-related condition can be included in the EREC registry. It is a very easy registry. There is no informed consent needed, and the physician can have a monthly electronic survey that lasts less than 5 minutes and can be customizable by the reporters. However, the Core Registry needs a patient-informed consent, and it takes around 5 minutes to input core data elements, and it is there where we can have longitudinal core outcomes, clinician and patient-reported outcomes, and we have there the condition-specific modules, namely the diseases that we want to register, and it is there also that we have a dynamic patient involvement, as I will show you later on. Of course, there is a data access committee, and the data can be provided to researchers, but of course, there is no way to give the data from one researcher to another without the approval. And of course, other registries can be affiliated with the Core Registry, as you can see in the slide. These are the centers reporting in EREC. You can see that there are more than 56,000 patients that they are registered in the EREC. There are 113 centers, and 19 are not ERN centers. And in the Core Registry, we have around 4,000 cases, and you can see here it's 51 centers from 20 countries, and 16 centers are not affiliated. And why I'm saying that? Because any center can be registered. It is there where you can create an account in the Core Registry. Feel free to take any pictures. You can go to this link. I'm gonna show you at the end. And you can just fill in the form. As you can see here, you have to fill the mandatory information, and the request will be approved as soon as possible. If the center is not listed, if you are from a center outside of ERN, you can add it to the platform, and any center, as you can see, could become an active participant. And after that, you can go to the patient management through the Core Registry. There are steps for patients registration, the Core Registry, and they are simple and straightforward. And of course, as I said, the patient consent is crucial before accessing the Core Registry, and the user can invite patients via email to complete the registration and fill out the prompts. Just to show you some examples, how to add the patient. You can add here a patient, then you should fill some mandatory fields, and then you should check the systemic and rheumatological conditions, and after that you will find the non-Langerhans histiocytosis modules, and it is there where is the Erdheim-Chester disease. I have to tell you that this initiative started with Langerhans cell histiocytosis, and then we decided to include also non-Langerhans histiocytosis and Erdheim-Chester disease. So if your patient consented to have access to the Core Registry, as you can see here, you can just click that. It's not that complicated, as you can see. These can be done after 5 minutes. Trust me, I have done that to some patients. And you can, after ticking that the patient has said yes to be accessed, you need to know your patient email address. The system will send the invitation link, and you can write an additional message and choose preferred language. And on the platform, patient can see the information that you have included about him or her, and fill in the prompts if required. So these are the examples. That's only 3 pages. Here is the basic module. You can fill in the data for the patients. You can, for example, check where the biopsy has been done to have the diagnosis, whether you have available BRAF testing or other mutations and the organs involved. Then you can fill in the treatment that has been given either in the past, or if there's a current treatment for your patient, and if any malignancies and comorbidities exist together with Erdheim-Chester disease. So these are the ways to conduct the Europe registry, and of course this is the link for self-registration, and I believe, and feel free to answer, to give me any questions or to comments. I believe that this can be a platform to register the Erdheim-Chester cases both in Europe and globally, and I think that the important fact is that patients can be involved in this. And with that, I would like to thank you very much for your attention.